Hi, this is Dr. Tracey Long, nurse and nursing professor, and we've got another story for you for the Healing Hearts campaign to honor those of you who are working on the front lines of the worldwide pandemic of COVID. Thank you for all of your efforts. This story comes from Sue Booth, and we're calling it A Nurse's Hope. Well, nurses have to give a lot of hope to patients, sometimes in the face of what might be very difficult statistics and a prognosis. Well, the story is told that she was at the ER working her heart out, and a patient was coming in from a helicopter. Well, he had had severe burns and did not look well. Did not look like this was going to be a good prognosis. Often we think that burn patients, they don't feel the pain because if it's deep into the third layers of not a full thickness burn, it burns off the nerve endings and they don't feel it. But they often are still conscious and awake and oriented to what's going on, unless they've had a head injury. Well, so this patient looked up into those nurses' eyes and said, well, what do you think? What are my chances? And she struggled to smile and said, I think you've got a 50-50 chance, dear. And so with that hope, he gets moved into the trauma area and they start doing all of their care for this patient. Well, finally, then the surgeon comes in to find out what really is the situation. And of course, the patient looks up to this surgeon and says, what do you think my chances are, doc? Well, the doctor said, do you want me to give you the truth? And docs tend to be pretty sharp shooting and don't mince any words. He said, I don't think you're going to survive this. And of course, the patient said, I like the nurse's chances better. That was a better 50-50 chance. Send me back to the nurse. Right? So sometimes that is the role of the nurse. Not that we're giving false sense of assurance and hope, but we are giving hope. And so thank you, nurses, for being on the front lines and instilling the power of hope into the hearts of your hearers, your patients, because hope can bring about miracles and hope can heal. Well, thanks for all you do. And if you've got a story you'd like to share, send it on our way to lifelonglearningeducation.com. And we'd love to share your story and spread the joy and inspiration. So with that, thank you for all you do and happy healing.